Narrative Theory by Megan, Emily, Polly, and Shoshana. What is narrative theory? Narrative theory is concerned with storytelling and the idea that sharing our story through different mediums helps us process and assimilate our experiences both individually and collectively. Narrative theory suggests that storytelling serves as a way of communication between individuals and a way of transforming values for socially constructed messages. Social work practitioners have a chance to learn about their clients' perspectives of events, as well as the meaning attached to their experiences by listening to their stories. Additionally, narrative theory states that each person or group may have a different experience of the same event. This is called multi-storied. There are 4 major practice principles of narrative theory. The first principle indicates that people communicate about their lives through the process of storytelling. People tend to be natural storytellers. This allows us to understand each other better. The second principle states that by storytelling, people attach meaning to their experiences, and according to principle 3, helping others change their interpretation of their story can be incredibly therapeutic. Lastly, Principle 4 suggests that storytelling can help individuals understand their experience in more liberating ways. Oftentimes, individuals will internalize negative experiences. Helping a client explore ways to perceive a situation differently may allow them to feel liberated and positive about their experience. Narrative theory is used across many different settings and populations. Since all individuals talk about their lives through story, narrative theory is less focused on specific types of clients or settings and more focused on the skills that the social worker utilizes with their clients. Some of the fundamental skills utilized in the practice of narrative theory are active listening, silence, and open-ended questions. Narrative theory is also often client-led and utilizes particular language to help clients externalize their problems. This helps clients to not only identify as strongly with their problems and opens up the doors for alternative ways of thinking or dealing with their problems. Some examples of practice settings where narrative theory is used is in community practice, individual counseling, crisis management, and case management. In each of these settings, the practice of narrative theory may look different, but the fundamental concepts are consistent. The way narrative theory is practiced across different populations is similar in nature. While individuals of all ages and with different mental health concerns can benefit from narrative theory, the practice will need to be tailored to meet client need. For example, with older adults, narrative theory can be practiced through telling stories from their life and reflecting on their life in new ways. However, for young children with sexual trauma, using art as a medium to express their story and reactions to their trauma may be a better fit for their developmental stage. Narrative theory is a natural fit for many individuals, as this theory uses narratives to prompt the use of storytelling within practice settings. Storytelling feels comfortable to various age groups of individuals and individuals from diverse ethnic and racial backgrounds. Children can benefit from the use of narratives by using creative outlets such as visual art pieces or by incorporating the use of children's books to develop and understand interpretations of experiences. Narrative theory suits social work practice by understanding the importance of ecological systems. This theory is not only concerned with the issues that individuals face, but also the interactions between individuals. This theory takes into consideration micro, meso, and macro levels to help better understand the diverse needs of individuals. Narrative theory aligns with social work's mission and values of social justice, as it is concerned with social construction and how negative social constructs can lead to societal messages that oppress populations such as people of color. Despite the strengths of narrative theory, there are some limitations. Social work has become concerned with evidence-based practice and developing a variety of research and evidence that supports the use of interventions. The evidence supporting the narrative approach is not highly valued by leaders within EBP. Although there are many studies that have evaluated the usefulness of narrative theory, These studies are often qualitative studies, as these types of studies are consistent with the philosophy of narrative theory. Narrative theorists avoid and critique the use of labeling individuals with disorders outlined in the Diagnostic and Statistical Manual of Mental Disorders. This can be problematic when working with agencies and in settings that require a diagnosis for treatment. Narrative theory is not a good fit within settings that require a more deterministic process based on research and evidence.